Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Nigeria Governors Forum speaks in favor of Oxford Astrazeneca vaccine, says country has not recorded any adverse reactions. Taraba State trains over 250 health personnel across 16 local government areas ahead of vaccination exercise. And EU agency confirms Astrazeneca is safe and effective. This review comes as 13 EU states post rollout of the jab. In Africa, over 4 million COVID-19 cases have been reported across 55 African Union member states, while 22 African countries have recorded not more than 10,000 cases. 23 countries have a record of between 10,000 to 100,000 confirmed infections. 8 countries, including Nigeria, have reported between 100,000 to 500,000 cases, while South Africa has the highest record on the continent of more than 500,000. As vaccination continues across the World Health Organization has recommended that countries continue the administration of the Oxford AstraZeneca vaccine amid growing concerns on its safety. According to Regional Director WHO, Dr. Mashidiso Moeti, the body anticipates that several countries will experience, and that's in Africa, a third wave in the coming week due to government easing measures, fatigue in adhering to public health guidelines, people expected to travel for Easter holidays, elections in some countries, and the variants which are traveling and appear to be more transmissible. So far, Ghana has vaccinated more than 420,000 people in just 2 weeks, covering more than 60% of the population targeted, while the vaccination pace in Nigeria remains on an increase. In Lagos, Nigeria, the vaccination update as at 16th of March 2021 shows that 12,720 people have received their first dose of the vaccine. The category of persons vaccinated include healthcare workers, other frontline workers, and strategic leaders. A breakdown, according to a tweet by the Lagos State Ministry of Health, shows the total number of persons vaccinated, the number of male and female healthcare workers, a list of frontline workers, male and female, the number of strategic leaders vaccinated. According to the state government, frontline workers and health professionals are advised to register online and visit any of the 88 approved vaccination sites to get the vaccine. In the meantime, the infection count in Nigeria stands at over 161,000. This is following the announcement by the Nigeria Center for Disease Control, with the latest infections being 200 recorded last night. The new cases were reported in 18 states, with a supplementary update showing an addition of 13 new cases not included in the FCT's record of yesterday. Lagos recorded the highest, following 42 cases, followed by Taraba and Edo, 29 and 17 cases respectively. And you can find some of the other states and the cases that they recorded. Sadly, 6 people have died from the COVID-19 related ailments, and the figure is higher than the 2 and 3 deaths reported on Monday and Tuesday respectively, increasing the fatality toll. An addition of 323 people have recovered from the infections in the last 24 hours. The agency also recorded 131 community recoveries in Lagos State, managed in line with its guidelines, including data from Taraba State recorded over the last 4 days. A total of 12,000 cases are still active in the country. And to news just then that the European Medicines Agency today revealed its investigation on the Oxford AstraZeneca vaccine, indicating that it is safe and effective. It, however, explains that it would continue to study possible links between red blood clots and the vaccine. This comes as the World Health Organization continues to encourage countries to keep using it, saying the benefits outweigh any risk and that countries across Europe should continue to use it to help save lives. Well, back in Nigeria, almost all the states in the country have received their share of the 3.94 million doses of the COVID-Shield with patent right from Oxford Astrazeneca vaccine facilitated by COVAX, a partnership between CEPI, Gavi, UNICEF and WHO. The delivery is part of the first arrivals in Nigeria, with more expected in the coming weeks. So far, about 35 states have been allocated, with most of the zones fully accounted for. Notable leaders, government officials have publicly taken the vaccines to encourage people that the vaccines are safe. In some states, healthcare workers have been prioritized, followed by politicians. Channels Television will continue to track how much vaccination is taking place across the country. Now, the Nigerian Governors Forum has reiterated their belief in the safety of the AZ, Oxford Astrazeneca vaccines, with a pledge to continuously encourage mass vaccination by all eligible persons in their states. Well, this commitment formed part of decisions reached during the virtual emergency meeting held last night, where they also encouraged Nigerians to report any adverse events noticed after taking the COVID-19 vaccines. The governors also reviewed the recommendations of the Presidential Economic Advisory Council on the development of poverty growth strategy for the country, focusing on macroeconomic stabilization, redistribution, structural transformation, and industrialization, among others. The Victim Support COVID-19 Emergency Intervention Program has donated a solar-powered borehole for hand wash stations, face masks, among others, to a secondary school in Obingwa, local government area of Abia State. Now, this part of the third phase of the VSF task force on COVID-19 measures and commencement of handover of water sanitation hygiene wash facilities to 54 schools in 18 states across the 6 geopolitical zones of Nigeria, of which 3 schools in Abia State are beneficiaries.
54 secondary schools across 18 different states of all the 6 geopolitical zones are going to be benefiting from these borehole facilities. In each of the schools, we're donating a 4,000-litre solar-powered borehole facility. We're donating 4 units of automatic foot pedal hand washing stations. We're donating 2,000 face masks to each school. We're giving hand sanitizers, disinfectants, and other hygiene consumables. And schools are very important to us because we understood how much our children lost in the protracted period of that lockdown. We also understand that our teachers were at home, mostly not doing anything, and it affected their survival and income, which is why, we decided that for high-density population environments like schools, it was important for the VSF to come and provide enduring long-term support.
Now, joining us from our Abuja studio is Mrs. Biola Ajenifuja. She's a pharmacist. Thank you for joining us on the program.
Thank you. My pleasure for having me once again.
All right. Now, do you agree that all vaccines are more beneficial than of any risk? And this is in the midst of concerns of some vaccines of COVID-19 across the globe. I mean, we've just heard of the report from the EMA saying that the Oxford AstraZeneca vaccine is indeed safe. But do you think this convinces those who have concerns, countries who have concerns about using the drug?
Yeah, I think the EMA lending their voice to the safety of the COVID vaccine will go a long way to convince a lot of people. And if we look at it, most of the people that reported the blood clots were just like 40 out of the 17 million that has been vaccinated. So the benefits way outweigh the risk. So I think we should go with it, and because we can't even really say if it's the vaccine that is really responsible for the AEFI that was reported as the adverse event following immunization. It might even be due to the excipients used in the vaccine. It might not be due to the API, that's the active pharmaceutical ingredient. So work is still ongoing. But I think that 40 people that reported the blood clot is a negligible number compared to the 17 million that has been vaccinated. And as usual with most vaccines, you can't rule out adverse events. I think is a normal thing. So for people not to even have reported any might even raise suspicion. So with that report, I don't think there's any problem with the vaccine, and they should go on with it think what should be done is to increase the advocacy level, and they should work more on increasing people's belief, and so that people can accept the vaccine better.
Have you received the vaccine, and tell us your experience, if also you had some common side effects?
Yeah, I was vaccinated yesterday. And as usual with normal vaccines, as I told you before, there are some AEFI that are expected, like the myalgia, that's a muscle pain, the pain at the injection site, then there was a slight headache. And this is normal with vaccines. You notice babies, when they are vaccinated, still baby running temperature. Some might even run serious temperature that the mothers start worrying, maybe they are sick. This is common with most vaccines. You can't rule that out. So that was what I experienced too yesterday, but I wasn't worried because I expected that to happen.
Now, the World Health Organization is saying that countries should be cautious that there might likely be a third wave with, restrictions opening up, but also because of fatigue to the public health measures and others. What do you think?
We don't follow up with the safety protocols, and if we don't increase the advocacy level to make people to get more people vaccinated, I think we can't escape that third wave. But if more people start getting vaccinated, we'll start having herd immunity, and more than 80% of the population will become immunized against the COVID-19. And before we know it, we'll start talking about eradication. We'll start talking about eradicating it out. The way smallpox has been eradicated out of the world, the way polio is being eradicated, and we'll start moving towards that. So I think more work should go into increasing advocacy level and increasing people's confidence in the vaccine so that we won't experience the third wave.
All right, Mrs. Biola Jenny Fuja, pharmacist, thank you for joining us on the program.
Much for having me once again. It's a pleasure.
Over in Taraba State, the government says it has trained a total of 254 health practitioners for onward vaccination of its residents through the Primary Healthcare Development Agency. It was disclosed by the Executive Secretary of the Development Agency during a sensitization exercise for health workers in the state.
It is no longer news that the long-awaited COVID-19 Oxford Astrazeneca vaccine is in Nigeria and has since been a source of relief to residents. Its arrival is one thing, and the processes involved in the vaccination exercise is another thing. Hence, a sensitization exercise by the Taraba State Primary Healthcare Development Agency to allay fears of residents on their perceptions. In view of that, the agency, saddled with the responsibility of vaccination, said it has trained a total of 254 health practitioners across the 16 local government areas and 168 wards of the state in a bid to successfully carry out the vaccination of 56,250 persons.
Up to 254 staffs were trained, 16 per LGA, and they are expected also, as from today, to commence stepping down the training at the local government level.
The World Health Organization, on its part, is assuring technical support to the state health sector in order to win the war against the pandemic.
With this coming of the vaccine, we are part of the planning, preparation for the receiving of the vaccine, and we try to see, we advise them technically with our expertise to ensure that right from the receiving, storage, and then administration of that vaccine will be in the right protocol.
No doubt the vaccines will go a long way in curtailing the transmission of the virus, particularly in isolation centers across the state, but the state government says it will not lower its guard in adherence to the safety protocols.
The fact that we have this vaccine does not mean we should let our guards down. We should continue with the measures already established. That is the so-called COVID-19 protocols.
For now, there is no official communication on when the COVID-19 vaccines deployed to the state will be administered to citizens or any of the state government officials taking the first jab.
Well, staying with the hot topic of vaccines, joining us right now is Professor Richard Abbala. He's a consultant, immunization and global health with Rambicon and research professor at the Nigeria Institute of Medical Research. He joins us from Baltimore in the US. Thank you for joining us on the program.
Thank you. Thank you for having me on your program.
First,
Good
give
evening.
us an idea of the progress of vaccinations in the United States where you are.
Well, the vaccination program here is actually moving on very rapidly. Say about 2 days ago, with the latest report that I have, they have by now in the US vaccinated over 113 million people, and about 40 million really are fully vaccinated. In other words, they've actually received the 2 doses for those vaccines requiring 2 doses. And that means actually that in the US, that about 12.2% of the population have been fully vaccinated. And the US, as a matter of fact, for now, in terms of the number of people vaccinated, are clearly ahead of the global, all the countries in the world. Of course, Israel is by far ahead, and they've vaccinated almost 50% of their population. But of course, the population in Israel is smaller.
Well, reports still show that, while around the world people are letting down their guard. For example, the US is reporting about 50,000 new cases a day. And this is around the annual pilgrimage for spring break, despite being in the middle of this pandemic. Do you see more waves of the virus, or is vaccinations going to catch up fast enough?
Well, I'm afraid there is every expert in the US now is appealing to the population not to let down their guards, as it were. The vaccination is going on all right, but we are still in the woods here, or they are still in the woods here, as it were. So they have to keep on the measures in addition to the vaccination that is going on. The non-pharmaceutical measures of washing your hands, using the mask, avoiding the crowd and what have you, until you reach a certain percentage of the population that are fully vaccinated. You're talking about 70 to 80% of the population, and they are not there yet. So the caution is that the vaccination is going on well, but maintain the non-pharmaceutical measures and avoid crowd and avoid exposing yourself to the infection. The issue is actually not the people vaccinated, but the fact that you want to protect yourself, but also think about those in the communities that are not vaccinated yet, so that you protect yourself more or less, but also do something to protect those in the community as well.
All right, let's come to Africa, and the perception here on vaccines. The Africa CDC did a study, 15-country study on the vaccine, and found that respondents who do not know anyone who has tested positive for COVID-19, those who think the threat of the virus is exaggerated, and those who believe in conspiracy theories are more skeptical of receiving the vaccine. And we know that this was a problem at the beginning of the pandemic. What's your take on how Africa is looking at vaccinations?
Well, that's a good question, and we have to be careful. That we have to recognize that in Africa, not due to our fault, but because of shortage of testing materials and what have you and expertise, that we are probably under testing. So we are actually, and because of that, also under reporting. So we don't actually know the actual numbers of people that are infected and people that are dead. So we have to be careful that the numbers may not be true reflection of what's happening. Having said that, I think it's the duty of everyone, and I think the government and the appropriate organizations in Nigeria and elsewhere are trying to make people aware of the importance of getting vaccinated and protecting yourself and the community from getting exposed to further infection. I think all of us, including myself, and I can assure you that I've been vaccinated, but I'm still carrying my mask. And I think all of us should be champions, actually. We shouldn't leave this to government alone. All of us should make people aware of the importance of vaccination. That's important for everyone to be vaccinated when it is available to you, because you're not only just protecting yourself, but also trying to protect the community at large. And that we need to get vaccination to a reasonable proportion of the community where you can begin to have population-wide broad protection or immunity in the community to keep the disease at bay.
We appreciate your time on the program, Professor Richard Abbala. Thank you so much, Research Professor at Nigeria Institute of Medical Research. Thank you for joining us on the program.
Thanks for having me. Bye-bye.
Flags have been flown at half-mast and thousands of towns have held a minute's silence as Italy mourned the victims of a coronavirus pandemic, which has left more than 100,000 dead in 13 months. Italian Prime Minister Mario Draghi led tribute in Bergamo, in an epicenter of the disease's first destructive wave a year ago, and where City Mayor Giorgio Gori said it had left no one unscathed. Here's more on our global update.
Venous thromboembolism is the third.
The World Health Organization is currently standing with the European Medicines Agency, which has said so far it has found no causal link between the vaccine and any clotting or blood coagulation reports. The WHO European Director Hans Klusch says gaining and maintaining public trust is crucial.
We need to keep the confidence. If it's lost, we need to restore it, particularly for Astrazeneca, which is the big supplier to the COVAX facility, which is the only facility which is really looking at a equitable access. So it's about being transparent, showing empathy, and being competent.
Not all European countries are being cautious about the Astrazeneca vaccine, though. Vaccinations are going full steam in the Belgian city of Antwerp. Belgium has not followed the example of the other 13 which have suspended use of the shot. The suspensions did not deter a large number of elderly residents of the port city from going to a vaccination center to receive the vaccine. Meanwhile, Italy today marked a National Day of Remembrance and mourning to honor the more than 100,000 people who have died in the country over the past 13 months from the coronavirus. Prime Minister Mario Draghi, along with Bergamo Mayor Giorgio Gori, led the tribute to victims of the pandemic in the northern city of Bergamo, which is the epicenter of the initial onslaught of the disease. Pakistan has received the second batch of COVID-19 vaccines donated by the Chinese government at a handover ceremony held at the Noor Air Base near the capital, Islamabad. The newly arrived Sinopharm vaccine doses are crucial to the further implementation of Pakistan's vaccination drive, and according to the Prime Minister, the efficacy and safety of the Sinopharm vaccines are very good. Finally, the head of Britain's National Health Service has received the Oxford Astrazeneca vaccine at a vaccination centre set up in London's Westminster Abbey. Sir Simon Stevens says by the end of the day, more than half of adults in the country will be vaccinated. Britain has administered more than 11 million doses of the AstraZeneca vaccine, and reports of blood clots were no greater than would have occurred naturally.
Continue to take responsibility. You can take a closer look at our website for more updates, a better understanding of the pandemic. You can see some of the top stories there at your fingertips. It's channelstv.com. And that's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.